Talk. Talk. Talk to me Tuesday.
Talk to me Tuesday on a Tuesday. I'm your host, Amadi B, and today I have a special guest, Dr. Stephen Smith. Welcome.
Hi, thanks for having me.
It's a pleasure to have you. So today we're gonna uncover a lot of great things. So I want to open up those lines of communication. If you guys have any questions for Dr. Stephen Smith and anything that he can definitely answer. So we want to thank you for coming on to the show today. We want to know a little bit more. You are representing Spring Spine Center.
Yes, ma'am.
Awesome. So tell us a little bit about yourself and also Spring Spine Center, what you guys actually do.
Well, I'm a chiropractor, and I've been in practice for 26 years. I opened the Spring Spine Center about 14 years ago. We've grown to 4 doctors, including myself.
Nice.
We provide anything ranging from work-related injuries, car wrecks, sports industries, to I slept wrong or just hurt myself in the yard.
Yeah.
We can take care of any of those kind of conditions for you.
Awesome. So we're going to uncover a little bit more about that. We're going to go into detail on scenario, and we really want to hear your expertise on the chiropractic side and on the spine side. So now you're a chiropractor in the state of Texas. Do the same rules apply state to state, nationwide?
Well, chiropractors are licensed in all 50 states,
Okay.
but there are some slight variations in rules from state to state.
Okay, perfect. So if you guys are watching from another state, make sure that you send us a message on either direct messaging or on the comment section. That way we can address that question. Every case is different. So sometimes we may need to get a little bit more details on the actual question. So we'll be discussing chiropractic care today, what it is, and how you can help a person recover from automobile accidents. So let's begin by uncovering what treatments and services you guys offer at your facility.
Well, primarily we perform spinal manipulation. That's our #1 tool that we use, but we also use passive modalities to apply in the acute phase: heat, ice, muscle stimulation, massage, things of that nature. And then when patients start to recover, we want to make sure we strengthen and stabilize their condition so we prevent injury in the future, so we have a full rehabilitation facility as well.
Nice.
We specialize in the treatment of disc injury, so we also provide a treatment called spinal decompression.
Okay, awesome. So it sounds like there's a process, right? There's a process of the heat, the ice, all of those treatments before, and then there's the exercise, right? The exercise and the rehab treatment. Is that how that kind of works?
Correct, and I kind of have a philosophy, simple philosophy. Every doctor you see has 3 simple jobs to do. Figure out what's wrong with you, explain it to you, and what can you do about it. Figuring out what's wrong with you is history, examination, diagnostics. The most common diagnostic thing that I order is going to be an MRI.
Okay.
Some x-rays, but mostly I order MRIs, and that's a little different from your average chiropractor, but because we primarily treat disc issues, that's where I tend to go. That's where we're going to diagnose the disc. Then explain it to you. And the best way to explain it to a patient, because most people are visual, so rather than read a radiologist report to a patient, I'll sit down with them and I will show them the pictures and go through the anatomical process and show them their specific condition. And then third and most important is what to do about it. So self-management, surgical referrals, or co-management with other providers. Specifically pain management is the primary co-management situation with a chiropractor.
So for those viewers that are watching right now, I do want you to explain the difference between the x-ray and the MRI. What do you see in an MRI that you don't necessarily see on the x-ray side?
So specifically x-ray are just for bones.
Okay.
Primarily we use x-rays to evaluate trauma, to make sure there's not a fracture or a dislocation. Unfortunately, x-ray has been overutilized in my profession for a very long time. It's not always indicated, and sometimes things that are being looked for in x-rays really aren't there. So that's why we rely more on MRI.
Okay.
MRI will show you everything, the bones, the ligaments, the muscles, the discs, the soft tissues, the nerves, everything. So it's a more comprehensive evaluation.
I love that. So that explains the importance of having an MRI, because you really get to see almost a full picture with colors, black and white and everything, especially for your profession. So now, right now, currently, Dr. Smith, we are going through a really hard time as a community, as a nation. So right now we're undergoing the COVID-19. So with this going on, how has that either affected your business and or helped your business during these times? Has anything changed for you guys?
Well, it certainly hasn't helped our business, but fortunately we are essential providers, so we have remained open. We did have maybe a 20% loss in patient visits, primarily due to those at risk or those who were fearful of contracting an infection. So the changes we made, we reduced the number of chairs in our waiting room. We offered the option of patients to call in when they arrived, and when their appointment was ready, we could go out and escort them into a private treatment room.
Nice.
So their exposure was minimized. We have always practiced disinfective techniques between each and every patient on our equipment.
Love it, yeah.
We've kind of ramped up that in this COVID to cover more of high-touch areas like doorknobs and countertops. And of course, the doctors and staff all have been wearing masks.
Right, right. Well, that's good that you guys have adjusted, but it sounds like you already kind of had some of those practices going on at your facility. Now, did you guys rely more on video calls, or did that not really benefit your type of profession?
Well, we did utilize that to some extent. Patients who were in active care and were fearful, we did use some telemedicine to call and check on them and do the best we could with home care, ice, heat, TENS unit, stretching. But primarily, we're a hands-on profession. You really have to be in the office for us to be able to provide the proper treatment.
Yeah, so video works to like a very bare minimum on it. So, I mean, going forward, is that something that you're going to try to incorporate, or because it doesn't really help, you need hands-on? Is that something that will, once COVID gets a little bit better in the our society, will that just kind of go away?
More than likely, mostly go away, but it is a nice tool to have just in case.
Yeah,
you know.
Absolutely. It's definitely saved a lot of people that are watching right now on having that video and that luxury of having that video on their fingertips. So now let's talk about a little bit about those common injuries. Now, you having, what did you say, 27 years? You have 26, excuse me, I'm adding one more. 26 years of experience, you kind of seen it all types of injuries, I'm sure. So what are some common injuries that you see patients as a chiropractor?
Well, 80% of the population will experience some sort of back pain in some time in their life. And most minor back problems are going to be mechanical in nature, and I like to consider chiropractic as the spine mechanic. However, sometimes an underlying condition like a disc herniation or degenerative disc disease can result in mechanical difficulties with the spine. And in those cases where we're adjusting, we're trying to correct that mechanical situation that's going on, and they're not quite getting well, we might want to investigate further, and 9 times out of 10 we get the MRI, and sure enough there's a disc hernia or something of that nature that is the underlying structural component of the functional problem that we're trying to correct.
Wow.
Certainly we also treat other conditions. Our other specialty is car accident victims.
So a common injury, you said car accident victims. Now, a lot of us that are watching the show right now, a common injury from an accident is whiplash, right? A lot of people probably are like, oh yeah, I've definitely felt that, or just from breaking abruptly. And it could be very painful too for some. So can you explain that injury and even that recovery process? How long does it last normally?
Whiplash can be permanent and develop into chronic conditions. 65% of all accident victims suffer from a condition called alteration of motion segment integrity. It's basically torn ligaments in your neck. When you're struck in a vehicle, your body accelerates from 0 to 10 miles an hour in 120 milliseconds. So there's a rapid acceleration. It's like the difference between your mom's minivan and your neighbor's Ferrari, okay? That rapid acceleration puts you back in the seat. And when you change directions that quickly, it can cause serious injury. More specifically, if you're unaware of the collision, it can make you 15 times more likely to be injured. And the NFL rules nowadays are kind of an example of that. So back in my day when we wore leather helmets and stuff, we dreamed of ear-holing someone.
Yeah.
So we're not allowed to do that anymore,
Right.
right? And the rule is you cannot hit an unsuspecting player, okay? Because why? The NFL even understands that when they're unsuspecting, they're more likely to be injured. And the same thing in a car crash. If you don't see it coming, you're more likely to be injured. And there's an old wives' tale that suggests that the drunk guy doesn't get hurt because he's relaxed. That's totally false.
Wow, that's pretty serious. And I know I want to uncover a little bit more. It just kind of sounds like the momentum of the actual object, aka the car, and then the person in the car, that all has something to do with the injuries and how severe they could be as well. So we definitely want to uncover that. Before we do, if someone has been watching right now that has been in an accident and they're looking at either they're undergoing pain or they have injuries, what do you recommend someone looks for when choosing a doctor like yourself to treat their car accident injuries?
Well, the most important thing would be, does your doctor have any postgraduate experience? Unfortunately, when we go through chiropractic school, they don't necessarily teach you a lot of specifics about car wrecks. It's a whole different animal outside of your normal neck and back ailments. Okay, so specific postgraduate training, number one. Number two, does this doctor work with other specialties to provide a comprehensive realm of care? Because there's more than just whiplash related to car crash injuries. And then, does the doctor understand how to document properly so that the information about your injuries is conveyed to the responsible party? Insurance companies have software that they use to input data from medical records, and they create a dollar value for your injury. Unfortunately, they can't give you a new neck, a new back. So all they can do is give you money.
Right.
So if the doctor doesn't document your injuries properly, that information won't get conveyed in their software. So that's a vital aspect, that the doctor needs to document your injuries properly.
Right.
And then finally, of course, is the doctor qualified to testify? Can you get up in court and substantiate your patient's injuries in front of a jury, and being under hostile questioning from a defense lawyer?
Right, right. Those things are very important. I know whenever looking for a doctor, those may not be questions that go in people's mind, right? Because if I were injured, or even you guys, like, you want to be comfortable. Oh my gosh, can this doctor make me feel comfortable, not scared? Can they help me get better? They're in severe pain. So these are great questions and recommendations, because that's normally what we think when we are injured. That's not the first thing we think about, for sure. But they're very important, so I definitely love those recommendations. So we do have a live question right now from Mark. So hi, Mark. Mark is asking, should I still seek treatment after a car accident, even if I do not feel physical pain?
The fact that you don't have pain is a good sign, but it does not mean that you don't have an injury. For instance, 90% of all rear-end collision victims will have what's called a concussion or a mild traumatic brain injury. Mild traumatic brain injuries require, per the International Classification of Diseases, 3 of the malady of symptoms, and there's a long list of symptoms, and they're not always pain. They can be sensitivity to light, anxiety, ringing in the ears, so on and so forth. And if you have those, you could have a concussion. Now, 2/3 of the time, that concussion will resolve on its own, but it needs to be monitored. And certainly, more serious than a concussion, you could have a subdural hematoma, which those symptoms would progressively get much, much worse. Vomiting, slurred speech, passing out, things of that nature, and you definitely need to go to the emergency room if that happens.
Now, when we're talking about a concussion, doctor, I know we're going to get a little bit more into detail here. Do they have to necessarily hit an item or an object, front, back, side, or is it just a jolt of the movement?
No, and in fact, in the literature states that you don't have to hit your head on any object.
Oh, that's scary.
Just the head moving back and forth and slamming inside of the skull can create a concussion.
Oh, wow. Okay. Well, that's a great question, Mark, for the simple fact that even though you may not feel any physical pain, having a good check may be also beneficial because it may be another maybe traumatic brain injury or a concussion. So what type of doctor in Mark's situation, and we do need to get more details, but if there was a concussion, what type of doctor would he have to go seek?
Well, certainly if he had those more serious symptoms, he would need to go to the emergency room and have a subdural hemo ruled out, okay? But beyond that, doctors like myself have an extreme set of questionnaires, and concussion is a symptom-based diagnosis, and it's not diagnosed with a CAT scan or an MRI or an X-ray or anything of that nature. There's no real objective findings. It's all symptom-based, and it has to do with your cognitive function. So there's questions that have to be answered, and you have to have the doctor that has the proper training to ask the right questions.
Mm-hmm. Wow. So that's it. And now those questions, does it go to the individual that has been injured or potentially injured, or even family members and loved ones?
Sometimes, yes, there's things that can be perceived by a spouse. For instance, you know, if today was the first day I met you, I wouldn't know what your normal behavior were. If you had become more aggressive or more depressed or sleeping more, I'm not going to be aware of that, and you might not be willing to reveal that to me or might not be aware of it. So sometimes family members can have significant input.
Wow, that's very important. So thank you, Mark, for that question. That's very important that we also keep that in mind. Now, I know you kind of are working or speaking about the concussion side, and it leads me to my next question. Do you work with other doctors that can help the patient recover from injuries, either different specialties, different cities and states?
Certainly here in Houston, we have a very large network of other providers that we work with for car accident victims. We have neuropsychologists, neurologists, spine surgeons, extremity orthopedic surgeons, podiatrists, dentists, plastic surgeons, pain management doctors, just to name a few.
Yeah, just to name a few. But yeah, those are important because, you know, sometimes they may come to you and you may need to make a recommendation to some of those specialties. So I think it's great to have them in your Rolodex. Now, we're kind of talking about car accident. For those viewers right now that maybe are into sports or athletes, do you also do athletic individuals or sports therapy or anything like that?
Yeah, certainly. I've treated many professional athletes, baseball, football.
Okay, perfect. And I know athletes travel all the time, so do you work with post-surgery or post-injury therapy as well? Or even if not athletes, if it's been in a car accident, they had to get knee surgery or something like that, do you work with those type of patients as well?
Yes, of course. And in fact, I did my own post-surgical rehab on my shoulder about 2 years ago. I tore my rotator cuff off the bone.
Wow.
So I rehabbed it myself in the office, and within a month I was back treating patients, and within 3 months I was 100% recovered, and my surgeon, Dr. George, released me, and he was amazed at how well I had done, especially for an old man.
He's not an old man, guys. He's definitely not. So tell us a little bit about that recovery process, because first of all, that sounds like it took self-discipline. I know sometimes when you're being pushed by either a trainer or a doctor, you tend to go a little bit harder because, you know, I have this doctor telling me to, right? But on your own, it's a little bit different. So where did you get that self-discipline to in a month? That's crazy.
Well, my knowledge as a doctor certainly was helpful because, you know, you have to, in rehabilitation, especially from post-surgical, you're going to have to push it. It's going to be painful. But with my knowledge and knowing what's wrong, I was able to, is that good pain or is that bad pain?
Right.
And I think even during the whole process, I only really experienced one bad pain that was a little bit more of a setback.
Yeah.
So I do have a little bit of advantage there, but I also have the knowledge to listen to the patient, you know, and help them understand, look, you're going to have some pain. And for me, that was the most pain I've ever had in my life.
Yeah.
And my knee has been bone on bone for 30 years, so that shoulder injury was the most painful thing I've ever been through.
Yeah, I bet. And that's good that, well, not good, but that you went through that because you could relate to the clients as well. You said off the bone, your rotator cuff, that's crazy. So we're talking ligaments, we're talking about the muscle, all of that. So you really could relate and give your testimony for someone that you are rehabbing, which that is also having a doctor that's kind of gone through something similar, I think is very, there's a trust factor there that you can definitely trust in.
Yes.
Now, we kind of talked a little bit and touched base a little bit on the specialty of disc and anatomy and all of that good stuff. And we want to kind of dive in a little bit deeper. So I want you to explain to our viewers what that specialty is, and are you actively practicing the disc specialty?
Yes, absolutely. Sometimes disc injuries are very obvious when you have back pain, you had a lifting injury or something of that nature, and pain shooting down your leg, loss of bladder function, or what's called a foot drop. That's obviously a disc injury. But disc injuries can also present themselves in a variety of other ways. For instance, the outer bands of a disc can tear, and that can create just local back pain. And it's not a textbook case, and it might need to be investigated a little further. And again, having the experience to be able to kind of sniff those things out when a patient's not recovering from just back pain. There's something more going on there, and we have to be able to dig deeper. And having more experience has definitely been a big help for that.
Yeah, and you did do an informative video on the disc anatomy, and what we're going to do, we actually got that video, okay? So what we're going to do is show our viewers a little bit more detailed information of the disc, the anatomy, and all that good stuff. So let's take a look.
At this point, we made the diagnosis of a disc herniation, so we're going to explain to you exactly what that is. This is a small model of the lumbar spine. The little bumps you feel down your back are here. So this is back, this is front. These little cylinders here are called vertebral bodies. We stack those on top of one another, and that's what makes up the spinal column. In between, we have a disc. Disc is a shock absorber. In the center, we have the spinal canal, which is where the spinal cord is. The nerves branch off the spinal cord, exit through these openings, and in the lumbar spine, they go down the legs. In the cervical spine, they go down into the arms and down between the shoulder blades. These little joints here are called facet joints. That's what allows for motion in the spine. And as a chiropractor, when we give an adjustment, this is the joint that we mobilize. Let's talk a little bit more about the disc. Typically, when we look at an MRI, we're looking up at the spine, so this is a view of that. The disc has a cavity in the center. The cavity is filled with a jelly-like substance, mostly made of water. Then we have rings go round and round, and they encapsulate that jelly stuff, not much unlike this. Layered like an onion, creates a lot of strength. So this is how we create the shock absorber. We have an axial force, which compresses and displaces the jelly stuff. The ligament bands expand, and that's how we dissipate forces. Unfortunately, what can happen with either micro trauma over a lifetime or significant injury like a fall or a lifting injury, we tear those ligament bands. You tear enough of them, we start to have bulging. This model shows us a little more detail with the spine. First thing you notice when you look into the vertebral body is you see the vascularity. Bones are very vascular, they heal very well. You break a bone 4 to 6 weeks, typically it's better. Discs, on the other hand, are not very vascular. They don't heal very well. They get their nutrients from day to day just by moving and drawing up or imbibing nutrients from those adjacent vertebral bodies. The other inhibiting factor when you have a disc injury is axial force. You compress that disc, has a hard time imbibing more nutrients when it needs to heal. So if you look a little further, the blue part is the jelly part that we talked about. The white part are those annular rings. The red mark in there is a tear. Okay? So if we look here, we can see what herniation looks like. And it can be dynamic just like that. We flex, we bend, it bulges and retracts. Typically on an MRI, we're going to see a best case scenario because the patient is laying on their back. That herniation can affect this nerve as it exits, and it can also affect this one as it goes by.
Wow, Dr. Smith, that's a great visual, and not just that, a great informative video about the disc anatomy. Now, we kind of want to touch a little bit about, what different injuries can happen on the disc. I know about herniations, but is that the only one, or is there other ones? And kind of explain a little bit more about that.
Well, there's a variety of things that can occur with a disc, and in regards to that video, I take a lot of pride and I practice in a way that education is the most important thing.
Absolutely.
And in fact, the word doctor was derived from a word that meant teacher. So if your doctor's not teaching you, he's doing you a disservice. So patients have a right to understand their condition and in a way that they can understand. Instead of blurting out a bunch of medical terminology, we need to use analogies and help them understand what's wrong so that they can play a role in choosing the type of treatment that they receive.
Right.
As it pertains to disc injuries, you've got acute injuries where the fibers of a disc will tear and the jelly material can herniate out or just create a large herniation that can cause pain in the back as well as irritate a nerve and cause radicular symptoms or sciatic type symptoms. Okay, that would be more an acute injury. Then we have more chronic deteriorating degenerative injury where poor habits throughout a lifetime, as we age, we gradually tear those little fibers. And if you think about those fibers like a rope, and there's, in a rope you've got thousands and thousands of fibers, and we do a little something when we're young, maybe we have played football or fell on our behind or in skating or something like that, and you tore a few of them. Well, it's weakened. So if we continue along that path of poor ergonomics and bad function, we're going to have a little bit more tearing over time. And as those fibers, more and more of them tear, the jelly stuff in the middle starts to lose its water content or hydration, and that reduces its shock absorbing ability, but also causes the disc to wear thin and deteriorate or degenerate. And I like to use the analogy of grape to raisin. Okay?
Yeah, that's a good one.
Yeah.
So is there ways, let's just say, with time, the disc, as you mentioned the analogy, grape to raisin, right? Is there a way to build that up, I don't know, with exercise, with diet, or you pretty much have to go in there with surgery?
No. When you have any kind of disc injury, whether it be an acute herniation or gradual bulge or degenerative disc, okay? Degenerative disc is going to come with a lot of spurring. Herniation is going to be acute, going to be a large herniation, is going to push out and cause a lot of pain. A bulge can also do the same thing gradually over time. The range of treatment for that is going to be self-management, and all too often patients have tried a bunch of things before they even got to me. Okay,
Right.
My job is to evaluate them, make sure they don't need surgery. Just because you have a herniated disc doesn't mean you have to have surgery. Okay? Indications for surgery are going to be loss of bowel or bladder function, loss of motor function. Okay, large herniations in the upper neck that could cause paralysis or even death. Okay. Or radiating pain that's so bad you can't stand it and nothing you've tried has helped. Okay, and that's really even elective in that nature. But the first three, the neurological issues, those are very serious and they have to be corrected surgically. And that's my job, is to evaluate the patient for that, the first line of defense. If they haven't had any other treatment, then if you can stand the pain and you don't have any neurological deficits, you don't have to have surgery. And lots of patients recover from disc if they can get past that initial phase. So what do we do to do that? We can refer for pain management, where they get a steroid injection either in the facet joint or in an epidural injection, and many people have probably heard of that, especially ladies who have had children. It's just a little different medicine. When you have a child, an epidural is done blindly, for one thing. And then also it's a numbing agent, versus a steroid is an anti-inflammatory. So if that acute injury, that acute disc is herniated, there's going to be a lot of inflammation. You inject steroid into the spinal canal, it can reduce that inflammation and relieve the pressure on the nerve, provide some relief. As I mentioned earlier, when you have a disc injury, you could have some mechanical aberration. For instance, if I'm having right leg pain, I'm going to walk a little funny and my back's going to get a little out of kilter, and that's the mechanical aspect of it, that sometimes we can fix the problem by manipulating the spine and alleviate that mechanical dysfunction, because it tends to go in a snowball like that. You get a disc hernia, you got sciatic symptoms, you tend to walk a little funny, and then it just snowballs from there. If we can interject and restore that mechanical issue, sometimes the disc will settle down. And then one of the things that we also do is spinal decompression, which is an advancement on traction, where we put you in a machine and we stretch your back. Okay, so that stretching can pull the bulge back in, relieve the pressure on the nerve, and reduce the radiating symptoms, and actually even correct the disc to some degree. And you can never make it perfect again. Just like if you cut your hand and you go to the doctor and you get stitches are removed, it's all better, but you still got a scar.
Yeah, correct. And so does this pain and what you're kind of describing, whether it's a herniation or a bulging disc, any of that, can that pain go away and then come back in a couple of months?
Yes, and certainly that's why it's important when your pain level is diminished to a certain degree where you can exercise comfortably. Because if you have dysfunction, you don't want to exercise. For instance, if I've hurt my elbow and I haven't restored full range of motion yet, and I'm exercising like this, that's really not doing me any good, is it?
Right,
I need to get full range of motion before I exercise and strengthen this back up. So the same thing with the spine, we need to have proper function before we strengthen and stabilize. And the strength and stabilization is vital to protecting the disc. When you bear down and tighten up your tummy muscles, that's how we protect a disc. And all too often, patients don't hurt their backs bending over and lifting up 500 pounds. They bend it over lifting up a sock or a shoe or a pencil because they don't think that that pencil is heavy, and they just go for it and they don't turn on their core muscles. Whereas if you're lifting something heavy, you're going to bear down and lift it up, right? And that's how you protect your back. Whereas, again, if it's not heavy, you're bending, but you're not just lifting that little pencil or whatever, you're also lifting you. And then physics, the power of leverage, if we all know what a cheater bar is, okay? So if you have a nut and you're trying to do it with a wrench and you can't get it to move, you put it on an extension and then because as we double the radius, we quadruple the force. So if I can exert 100 pounds of force here, now I can do 400. So the same thing when we bend forward. When we lift forward, we quadruple the pressure on our lower back. That's why we have to tighten the core before we bend. In every application, whether it's bending over to brush your teeth, picking up your shoes, whatever the case may be.
And I know core muscles and your core, having a strong core is very important to prevent having back injuries.
Correct.
I think that's awesome. So I've had a back injury before, and my first instinct was, oh my gosh, I need to stretch. Let me stretch it out. But that might not be the smartest thing, right?
Not always. Certainly if you've tried stretching and it's not improving, then by all means you need proper evaluation.
Yeah, so definitely first suggestion, proper evaluation. If you guys are having some type of back pain or even stemming from a car accident, I think this is very important that we have Dr. Stephen Smith. So we do have a live question from Catherine. So Catherine is saying, are neck adjustments safe?
Yes.
I think this is a common question. Catherine, this is a great question. So a lot of people are scared to get their neck adjusted, and if it's one little wrong movement, there you go. But let's talk about how they are safe.
All right. So part of the issue there is we all learn by what we see, and human beings watch a lot of TV. So we've all seen the action movie where there's a fight and somebody, and then it's bad news.
Yes.
Okay?
Yes.
Well, two things. A, that's TV, it's not reality.
Right.
And B, that method is what we would call high velocity, high amplitude. So really fast and really long, okay? We don't adjust that way. It's high velocity, low amplitude. So that's one thing. And again, what you see on TV isn't always the truth.
Right.
That sound that you hear on TV, they actually make that with the head of celery.
Okay.
So the sound you hear when you get an adjustment is your ligament stretching, just like when you pop your fingers. It's tissue stretching. That's what makes the sound, okay?
Got it.
So we're distracting a joint. So if I was going to break your finger, I couldn't do it like that, could I? And that's the exact same thing we're doing in your neck, just taking the joint to its end range of motion and then applying a force and distracting the joint.
Okay.
One analogy I like to use is a frozen shoulder when I'm talking to other professionals, medical professionals, about what it is that I do. So a frozen shoulder, if you have a shoulder injury and you don't move it around, then eventually you can't lift it.
Right.
So it's called, medical term is adhesive capsulitis. So you basically have adhesive capsulitis within the joints of the spine. When we lose function here, it's easy to see. But in the spine, you've got 24 movable vertebrae with a joint above and below, left and right on each one of those.
Wow.
So that's a lot of joints that can become or lose function that need to be mobilized.
Right.
Okay. As far as the safety and the efficacy as well, safety number one, if you don't have an underlying serious condition like brittle bone disease or some of that in that nature, and of course with Medicare patients we always ask about bone density exams and things of that nature, or if they had a pathological tumor or something of that nature, but those things are rare. Okay. Also, some other things that you might see in the media are strokes. So I think there was a recent Playboy model that had a dissecting aneurysm cause a stroke, cause her death. And she happened to see her chiropractor. And of course the media goes out of bounds with that and says the chiropractor killed her. Okay. That's actually not true. So in Canada, they were having some of that in Canada with dissecting aneurysm. And let me explain that a little bit. So the blood vessels in your neck, there's 4 of them, 2 carotids, 2 vertebral arteries. The vertebral artery makes a little serpentine track up in the upper cervical spine. So the makeup of a blood vessel is kind of like a garden hose, if you will. You cut a garden hose in half. You have green on the outside, and then you have like a mesh, and then you have black on the inside.
Right.
Okay. So as it relates to an artery, if we slice the garden hose down this way, the black stuff on the inside is called the intima of the artery. So if that intima is peeling away like this, that's called a dissecting aneurysm. Okay, and then it can peel away and then head north, and then a stroke occurs. Okay.
Got it. Okay.
Well, the symptoms of a dissecting aneurysm are neck pain, headache. Okay. So they were having some of this in Canada, and they decided to investigate. And of course, we know Canada is socialized medicine, so the government did these studies, 3 studies. The findings were 1 in a million, 1 in 3 million, 1 in 5 million, 3 different studies.
Wow.
So I've been in practice 26 years, and I have not yet adjusted 1 million patients. Okay, so the incidence of that is pretty rare.
Right.
Okay, and to go one step further, in Canada, they actually litigated some of these cases for the family members, and it was actually determined that because the symptoms are so relatively benign that the average doctor is going to miss that. You come in with me neck pain, headache, well, I don't think you have a dissecting aneurysm, right?
Right.
So the average doctor is going to miss it, and the fact that they determined was the patients are typically having the dissecting aneurysms because there was no change in the number of dissecting aneurysms in patient population that had not had a chiropractor versus who had seen a chiropractor. Okay, so you think about that.
Right.
So if there was an uptick in the number of dissecting aneurysms in chiropractic patients, there would be a concern, but they're exactly the same.
Right.
So medico-legally, it was determined that just so happened the patients saw the chiropractor while they were having a dissecting aneurysm. So there was no causal relationship. And one more way I like to confirm that is risk. So who takes care of risk in our lives? Insurance companies, right? So if I drive a sports car and I've had 6 accidents last year, what's my insurance premiums going to be like? They're not going to be pretty.
Exactly.
Right?
No one's going to like those.
So the same thing with doctors. If you're a high-risk doctor, you're going to pay a lot in malpractice premiums. My malpractice premiums are less than $2,400 a year for $1 million policy. Okay? A medical doctor friend of mine who's a pain management doctor, he can't get $1 million policy. He can only get a $250 policy. And it costs him $40,000 a year.
Wow. That's crazy premiums right there.
So, and not to suggest that what he does is not safe, but
Right.
the safety of chiropractic is proven, and again, nobody knows safety other than an insurance company.
Yeah, and look, I'm going to kind of segue a little bit more on Catherine's question. Catherine asked, are neck adjustments safe? Now, if I were a patient right now and I lay down and you're like, okay, I'm going to adjust your neck, I would tense up.
Sure.
So do people need to relax? What's the proper etiquette for the person getting adjusted so that they're not scared? There's a lot of people
Sure.
that are scared of getting their neck adjusted. And again, I love that you uncovered the myth, but what can help them relax, and is relaxing important?
Well, first and foremost, if you have fears, bring that up to the doctor and ask them. Get them to explain, like I just did, to calm your fears, okay, that you don't have anything to worry about here, all right? But then the other thing, I always tease my patients and say there's nothing better than a sneaky chiropractor. Okay? Of course, that goes with informed consent. I will say, Mari, I'm going to adjust your neck right there. You're going to be some popping. Are you okay with that? And then you give your consent. You say yes, and then I kind of will chat with you. I'm palpating your neck and talking about whatever you're doing this weekend, and move your toes, and then I get you.
Oh, you get me. There's
Okay.
sneaky. Okay. That's awesome. Okay, well, thank you for that question, Catherine. Now, we do have another question from Wallace. Hey, Wallace. So Wallace is saying, is it true that chiropractic care can help your body heal? If my hands have some type of numbing sensation, if I get a chiropractic care, will that help?
Well, again, I always come back to a proper evaluation and proper diagnosis. So it would depend on the source of the numbing in your hands. Numbing in the hands can come from a vascular issue or a neurological issue. If it's neurological, it could be something like carpal tunnel syndrome, or it could also be coming from your neck. If it's numbness, it could be a vascular disease like peripheral artery disease. If you're a diabetic, it could be what's called glove and stocking peripheral neuropathy. So it depends on a lot of things. And again, why you can't diagnose someone over the phone or over the internet. You've got to come in and be properly evaluated.
Absolutely, yeah. And I know during these times, You guys are open right now. I know a little bit making sure the patients are comfortable. So during these times are a little bit different on the evaluation, but a strong recommendation coming into the office, getting your doctor to make that proper diagnosis. So should someone see a chiropractor regularly?
I have mixed emotions about that.
Okay.
I think my profession pushes that a little too hard, and I think that's more of a practice building thing. Okay, but then I could certainly make the argument that, again, that I made earlier, that 80% of the population is going to have some sort of back pain, and most of it's going to be mechanical in nature. If you head off that mechanical problem by make sure everything stays functioning properly, just like maintaining your vehicle. You know, you're not going to drive your vehicle 100,000 miles without changing the oil, rotating the tires, getting a front end alignment, you know, things of that nature. Because if you don't take care of your vehicle, which is a machine, it will fail. And the same thing with your body. If you don't take care of it and make sure it's functioning properly, it's going to fail on you. And you're more likely to be injured when you have some sort of mechanical dysfunction going on. And all too often, patients don't have any symptom of the mechanical dysfunction until they get an injury because of the underlying. So it's kind of a mixed bag of answer there. You know, if you're really not having any issues, probably not. But if you're active and you're involved in sports or your job is physical, then by all means, you probably should see one on periodically.
Now, I do say I personally work out a lot. I do a lot of stretching, and I've gone to a chiropractor maybe once every 3 to 5 months. And I feel literally a lot taller, and I'm actually really short. But how often do you suggest on maybe like a common person like myself that just works out and doesn't do anything?
I think someone who exercises like yourself and is aware of their issues in their body is going to know. Okay.
Got it.
And most of my patients that are at that level, I tell them, hey, come see me when you need me.
When you need me. That's a good one. So there is no really strong suggestion on regularly. It depends. Like reading your body is very important because that is what's going to determine I need to go see Dr. Steven Smith, right?
Right. And on the other hand, you know, not everybody might be as in tune with us. So that's up to the doctor to evaluate, hey, this person's in tune with themselves. They understand mechanics. They exercise a lot versus the couch potato who doesn't do anything.
Right.
And I typically will tend to see them, you know, monthly or every 6
it.
weeks or so. And sometimes they'll come in and they're fine, and then the next time they'll come in and they'll have an issue. And sometimes that issue is resolved with one treatment, and sometimes we need a couple. So
Yeah.
it varies.
It varies. Okay, perfect. We do have another question here from Cindy. This might be a hard question for you. What exercises can I do for back pain?
Well, that's an
Loaded
easy
question.
Yeah, that's a loaded question. So again, back to the proper evaluation. If you exercise when you have pain, you can actually make your problem worse. All right? Exercise is not meant to cure pain. Exercise is meant to strengthen and stabilize to prevent injury. So while you're hurting, you probably should lay off the exercise. Try to get better on your own. Ice, heat, you know, rest. Take it easy. If you're not responding, then you need to get a proper evaluation. Okay? Self-treatment. It's like that commercial where the guy, you know, he's going to do his own appendectomy because he learned something on the internet.
Oh gosh, no, don't do that. No, don't do that. And look, doctor, I will tell you, I'm that stubborn person that whenever I get injured is from working out and I go to the doctor, that is what the doctor says. Maybe you need to stop for 2 to 3 months, depending on the injury, right? I've had like a pull hamstring, a pull quad, and I'm like, no, I can't stop exercising, but it sounds like that is important to kind of allow either the muscle, the ligaments, and everything to kind of rest a little bit.
Well, 2 to 3 months I think is a bit excessive. As I mentioned earlier, I tore my rotator cuff off the bone and I only stopped for
1 month.
a month.
Yeah.
So I think 2 to 3 months off, you would have to have a really serious injury and definitely should have some sort of treatment. Okay, and the other thing, and I'm not trying to knock any specialty here, sometimes patients go to the wrong doctor for back pain. Okay, and I'm not picking on primary care physicians because I have lots of them that I treat and that refer to me and I love them to death, but they'll be the first to admit that's not their forte. Okay, just like if you came to me for a heart condition, yeah, I studied that stuff in school, but I don't treat that. I don't practice that. That's why we call it practice.
Right.
When we practice, we're good at it.
Yeah.
So if you
Yeah.
go to the, you know, you want to go to the right doctor. Okay,
Correct.
and chiropractic is the portal of entry for neck and back pain. okay?
Yeah.
You don't need to run to the surgeon because most people don't need surgery. And all too often, and this is how I've even built my relationship with surgeons over the years, because when I send them a surgical case, it is a surgical case. Surgeons don't like clinic days. They don't like having to see patients that don't need surgery. It's a waste of their time. They want to be in the operating room. They have to be in the clinic to evaluate people for surgery or post-op. And a lot of times they'll have a PA or an NP that will do those pre and post-op evaluations. They want to be in the operating room. So when I built my relationships again with surgeons, I send them cases that each and every one of them needs surgery. Why? Because I did all the preliminary work. I worked them up, they got an MRI, we did everything we could. They've got some sort of neurological deficit or they've not getting better with everything that's appropriate for that. And then they come to the surgeon, hey, there's a surgical case. And I've actually had surgeons reach out to me and want to meet me because of that.
That's awesome. It's a great compliment. Now, I know you were just saying some patients or some injuries, they're not going to the right doctor, okay? So how can we help the viewers that are watching now go to the right doctor? Is there something that they can do? Is there one specific doctor that will make those recommendations to get them to the right doctor? Because that's what's a little challenging. I don't do what you do, so I don't know. What is the right doctor to go to, right?
And even the right doctor within a set specialty. If neck or back pain, it should be a chiropractor. Does that mean that any chiropractor? No, I'm not going to stand here and endorse any chiropractor that I don't know. And you should try to find a chiropractor from friends or family or coworkers that have had a good experience there. And all too often people just look for someone that's on their plan or someone that offers free this or free that. Okay, that doesn't necessarily going to get a good adjustment.
Yeah.
And here's one of the ways that chiropractic is different from a lot of medical professions. Let's say you go to your primary care physician, you've got a upper respiratory infection, they give you an antibiotic. Okay, so you take the antibiotic, you get better, right? You took your treatment home, it's in a pill bottle, and you take it and you get better. So the next time you go to your primary care physician, he or she is not in, so you see their associate or the nurse practitioner. And they diagnose you with the same thing, and you get the same antibiotic, and you get better. It's the same treatment from a different provider. When it comes to chiropractic, manipulation is an art. It's a skill. Okay, I'm far better now than I was 26 years ago when I started practice. You get better, you learn, okay, and you have to practice it. So, there might be, if I'm a 300-pound guy, I might not want to see a 110-pound, chiropractor. So they might not be able to handle me. Okay,
Right,
so there's a lot of things, and you might try a couple, 3 of them before you find the right one.
Right.
But first and foremost, you should try to get a referral to one that's reputable from one of your friends or family.
Yeah, that's definitely important. So if you guys are watching, those are good takeaways from getting to the right doctor. So let's be a little bit specific. Now, on the spinal column, it goes all the way up from your neck all the way down to lower back, right?
Correct.
So do you treat every section of the spine the same whenever you treat, if there's any injuries, rehab, etc.?
Well, it depends on the injury, number one, and then there are different techniques for manipulating the neck versus the lower back, and it has to do with the orientation of the facet joints. So I think you saw in the video earlier, the facet joint is a little joint that moves. On the lumbar spine, they're oriented like this, and as they move up the spine, they kind of go like this. So the direction of the manipulation has to change according to what level of the spine we have the loss of function in.
So it almost kind of seems, if someone's standing here, it's kind of like an S shape, your
Correct.
spine, not straight, obviously, right?
Yes, and those are called lordoses, and there's a lumbar, like sway back, that's lumbar lordosis, and there's a cervical lordosis, and then the thoracic spine has a kyphosis, where it sticks out. So you do have that S-shaped curve.
Nice. So let me ask you this. Do the exercises differ on whatever section of the back it is also?
Yes, of course.
Okay.
Yes.
So I know a lot of you guys are asking my viewers if I have back pain. So of course those exercises will vary, will differ on where the back pain is, on what part due to that. So I think that's very important for us to also uncover. But the more important is go to your doctor so they can let you know on your case basis, right? Okay,
Correct.
definitely. So last question, one of the few questions that I have. So can back pain cause other dysfunctions or other pain of the body?
Well, I'm not a real big advocate for treating the back for ulcers or asthma or things of that nature, and there is a lot of that founded in chiropractic. As I mentioned earlier, 80% of the population will have back pain at some point in time, and most of it is mechanical. We are expert. We are biomechanical experts. The law in Texas even says that we are biomechanical experts. That's what we do, and that's what we're good at. And if we would only just stick to that, I think we'd be a lot better off, and we wouldn't have as much of a negative stigma attached to us if we would just stick to what we're good at, which is biomechanical issues.
Yeah, for sure. Okay, perfect. So now if someone's watching our show right now and wants to schedule an appointment, what is the process for scheduling an appointment with you at Spring Spine Center?
Well, we have two portals, primarily telephone.
Okay,
And we answer our phone. We do not have choose 6, choose this, choose that. We answer the phone.
Okay. Awesome.
With the caveat being lunchtime, sometimes it'll roll to voicemail. But if you understand, it's lunchtime, that's why.
I understand, for sure. You got to eat.
My folks, my staff has to eat, but we answer the phone.
Okay.
And if you have insurance you'd like to verify, if it's a health insurance issue, we will verify that for you, and we will get you in the same day or early the next day.
Nice.
At the latest.
Okay.
Certainly if you're involved in a car wreck, there are a variety of different paths. You can go there. Sometimes you use your own insurance, whether it be personal injury protection. So, this is a public service announcement. If you do not have personal injury protection on your car insurance, go get it now. My car insurance, and I have very expensive cars, is I have $10,000 in PIP coverage, and it costs me $44 a year.
Oh, wow.
$44.
Not bad.
Okay. The most expensive part of your car insurance is the liability. If you look at your breakdown on your declarations page, you got liability, you got towing, you got rental car, you got uninsured, underinsured, and you got PIP. And PIP is the teeny tiniest little insurance.
Yeah.
And it comes in handy when people are uninsured or underinsured.
Yeah.
Okay, so please, if you have car insurance, go out and get it and tell your agent to give it to me.
Yeah, that's a steal. $44 for your situation a year, so that's awesome. So let's talk about if they were to schedule with you. I know all of us, some of us, when we go to the doctor, my pet peeve is the forms. There's so many forms, okay? Do you guys is there forms for them to fill out? Do you guys also email them ahead of time so they can get started? Is that the initial setting up?
We can do either one of those. You can fill it out in the office if you need help, or we can email them to you. And unfortunately, in today's day and age, documentation is everything, and we just have to do it. Not only is it important for documentation that you're who you say you are, but also so that we uncover any comorbidities like diabetes or osteoporosis or things of that nature. And that's why we ask those questions.
Yeah, so they are definitely something that you will do, but you guys make it easy for the patient coming in. That way you guys can either do it prior to, if you guys are time constraints, then yes, you could definitely fill it out before. So we're kind of coming to the end of the show. So I do ask any guests that are coming onto a show, if you had a piece of advice or a quote or anything that you want to leave our viewers with, what would you tell our viewers right now?
Well, hopefully one thing you've taken from me during this interview is that I'm very passionate about what I do, and I love what I do. And I've always tried to teach my kids, you don't have to make a bunch of money to be successful. You need to be happy to be successful. And a few years back, I ran into a sign and I actually inadvertently stole that quote from Buddha. So find your passion, find what you love, and you will be successful and you will be happy.
Yes, I think that's a great message, and this goes for anyone, either seeking medical attention, trying to just do something. If you're happy, you could be very successful. So I definitely love that piece of advice, and we want to definitely have you on the show again.
Thank you.
Because I do see your passion. I know after having this conversation, I feel comfortable to where I would want to give you a try. Like, I see your knowledge and I see how educated you are and how you're willing to teach, and I think that's so important. So we might have to have you for round 2, because it's like, I feel like there's even more knowledge you didn't even get to touch today. So we'd want to have you on the show again, and let us know what you guys think of the knowledge of Dr. Stephen Smith. If you guys have any questions, still load them up. We'll definitely answer them after the show. I want to thank all of you guys for watching the show, most importantly for sharing the show. The more you share, the more we get to educate our community, and we can make a difference to our surroundings. So I want to thank you for tuning in to Talk to Me Tuesday on a Tuesday with your host, Madi B and Dr. Stephen Smith. Bye.